Welcome, everyone. It is 6:01 and we are still seeing people join us through Zoom. So we'll go ahead and give it another minute or so to make sure that people can join, and we will go ahead and get started. Thank you so much for being with us. All right. Once again, welcome everyone on this lovely Tuesday, March 1st. It's incredible that we're already in March of 2022. My name is Karina Guzman Ortiz, and I'm Partner Engagement Specialist here with the Early Learning Division. And it's a joy to be with you all again, understanding that you've all had a very long and busy day already. We'd like to go ahead and get started. On our next slide, we're just walking through our interpretation, and just want to make sure that those who need interpretation are able to join. We have interpretation available in Spanish, Russian, Vietnamese, Cantonese, as well as ASL. If you are joining us on Facebook and need ASL, please go ahead and join us on the Zoom channel. This way you will be able to see the video. We do have CC transcripts available as well. If you're on Zoom, you can go ahead and select those CC transcripts, the closed caption. Under your screen, there's a little rectangle with the CC on there. Can we go to the next slide, please, just so that people have a visual of what to click. So if you need interpretation, find this globe button at the bottom of your screen, kind of bottom right corner. It should be, whether you're on your phone or on a computer, and we'll be able to select the languages. Para quien nos acompaña que hable español, puede cambiarse al canal de español presionando el icono de un globito que está abajo de su pantalla. Ahí podrá seleccionar el idioma español y así podrá escuchar a nuestro intérprete que nos está acompañando esta tarde. All right. We do have the chat feature turned off, but we will be following comments and questions through our question and answer box. You can also find that at the bottom of the screen. It looks like two little message icons. This is where you will be able to ask your questions, and we'll go ahead and ask those throughout the webinar. Lastly, in terms of the question feature, due to time and content, we might not be able to get to all of the questions, but we'll go ahead and follow as we can via email after this webinar. If you're watching us on Facebook, also know that we are keeping an eye on those comments. So if you have questions and are on Facebook Live, please go ahead and make those on the comment section, and we'll also be looking at those. And just as a reminder, the webinar will also be posted on our website, a recording of this on our website, and you will also be able to find the recording on our Facebook page for later reference, or to be able to go back and rewatch some sections if needed. And with that, thank you so much again for joining us. We'll go ahead and review our agenda and then move on to today's conversation. We'll start with checking in on COVID with the Oregon Health Authority, and secondly, we'll go on to learn a little bit more about our ELD rulemaking process. We're very excited to share this with you today, and we'll end by reviewing some upcoming rules for public comments, some timelines there. As usual, we'll make room and time for questions after each topic, and we have our fantastic Ronnie Pham joining us to help us with this portion of question and answer. So I'd like to pass it on to our teammates, Meg, Carrie from OHA, and Miriam Cecilia, who is from the ELD. So if you would both please introduce yourself, and the floor is yours.
Thank you, Karina. Hi, my name is Miriam Cecilia. I'm working with the Early Learning Division and doing some COVID response lead. We also have Dr. Carrie here with us today again, who is our Senior Health Advisor from Oregon Health Authority. We do have some COVID updates. As you can probably tell, the state is starting to respond to COVID a little bit differently, with decrease in hospitalization rates, decrease in COVID-19 case rates, and increase in immunity. We're able to kind of look at this pandemic, beginning to look at this pandemic a little bit differently in terms of how we'll respond, rather than as a state of emergency, in terms of dealing with the virus as kind of an ongoing endemic part of our lives, and focusing more on best practice and being able to keep our kiddos safe and healthy in childcare as we move forward. So we do have some updates, and Meg's going to go over those in detail for us today. But just so you know, things are moving pretty quickly, and we are expecting some of these updates to come out and an announcement tomorrow, actually, but you're going to hear them first tonight. While we do have a little bit of a time lag in how quickly we're able to get our documents translated and formatted and all that, we're working really hard to get those the ELD COVID requirements and recommendations document updated, but you will continue to hear announcements via our childcare updates bulletin. So if you're not subscribed to that, I recommend you get on our ELD website and click the button to subscribe here, because that's where you will hear breaking news as it comes, and through social media. So I will welcome Dr. Carey to walk us through some changes, and then there will be some time for questions. Thank you.
Thank you so much, Miriam, and thank you all for welcoming me back tonight. I'm delighted to be here, and as Miriam said, once again, we have new updates to share, and the two big ones that we're going to talk about today are ones that were previously announced on the lifting of the indoor and K-12 mask mandate, and then a second update on the quarantine guidance. So we'll walk you through the updates in this slide deck. There's lots of links to additional resources, and then, as Miriam said, we anticipate some more public announcements in the week going forward, but we're really excited to be able to share these updates with you all tonight so that we have time for questions, because these changes are hard. Next slide, please. So after March 11th, masks will no longer be required in childcare settings in any indoor spaces, nor in K-12 school settings. And the reason for this is really to shift to local discretion. As Miriam described, public health response is a balance between statewide mandates for the entire state and local responses, be it individuals, individual programs, individual communities that can really respond to the unique needs of that of your particular local circumstances. The indoor masking rule has always allowed programs or individuals to have more restrictive masking, to wear masks for longer and in different settings than was required by rule, and that is not changing. So individuals and programs may decide to continue to wear masks because of their local circumstances. The CDC has aligned with these rules in that they no longer require masks. They no longer require children to wear masks on buses or vans to and from their childcare programs. So there will be alignment both in transportation and in the indoor space school and childcare settings. Of note, the federal guidelines that require masks on public transportation still stand for the moment. So if you're riding public buses, masks are still required there. We appreciate that the Office of Head Start had its own masking requirement, and they are currently reviewing that masking requirement, knowing that it is now out of alignment with the CDC. And so just anticipate updates at some point on their website with their revisions to their rule. I don't yet know what they will be. Next slide. So that was masking requirement. In terms of the masking recommendations, we continue to support programs and individuals who choose to continue to wear masks, knowing that we all have very personal reasons and very specific reasons why we make different choices about our health. We also will continue to recommend that all individuals 2 years old and older will wear a mask while indoors at childcare when they are on days 6 through 10 of their isolation if they've returned to childcare. So isolation at this point is a requirement to be at home for the first 5 days, and then you can return to childcare as long as you have been fever-free for 24 hours and your symptoms are improving. But we recommend, as we always have, that you wear a mask on those last 5 days of your isolation. In addition, in alignment with the CDC, we recommend that individuals who are unvaccinated or otherwise at risk for severe COVID continue to wear a mask when there is a medium level of COVID transmission in their communities, and that all individuals, regardless of their vaccination status, continue to wear masks indoors when there's a high level of COVID in communities. And on the bottom is both a link to the CDC's map of community level transmission, COVID community level transmission, and the current rankings of communities. And so you can see that across Oregon, most of our communities are either in the medium to or high level of community transmission. So again, those areas in the red continue to wear a mask. Those areas in the yellow, if they stay in the yellow on March 12th, when the masking rule is revoked, some individuals may choose to not wear masks. Next slide, please. And this slide is one that was presented last month, and it's just a reminder that obviously during snacks and meal times, masks cannot be worn, so we recommend that children keep distance or eat in cohorts. And masks have never been, or have not recently anyhow, been required outside, and that is still the case, and masks should not be worn during naps. Next slide. So this is the next big update. And notably, this is updates for the ELD settings, for childcare settings, and for K-12 settings. At this point, isolation for those who have contracted COVID is to stay at home for 5 days, and then return to your childcare setting as long as your symptoms are resolving and you've been fever-free for 24 hours. In those second 5 days, or days 6 through 10 of your isolation, we strongly recommend wearing a mask while in childcare settings or in public settings, but we no longer require that masks be worn by everyone in the classroom. After March 11th, when the indoor masking rule is revoked, there will be a pause on all quarantine in K-12 settings and childcare settings. And the reason for this is that quarantine has limited impact when there is rapid asymptomatic transmission of a virus, and the Omicron variant has proven itself to be very rapidly transmissible. In addition, by March 12th, we anticipate that our community levels of COVID will be significantly lower. Our current levels of COVID have just plummeted in the last weeks. And part of that is due to the community now having high levels of immunity, be it from vaccination and booster shots or from having a recent infection. And we know now that having had an infection, in addition to vaccines and boosters, can protect us from reinfection from COVID, at least for the immediate few months. So after March 11th, individuals, teachers, children, regardless of whether there is masking in their classroom and regardless of vaccination status, will not be required to quarantine. We recommend that childcare programs notify children when they have been exposed by another child or by a staff member, but the child or the staff should not be excluded from their childcare setting. The notification allows families and staff members to take the precautions they need to take for their own personal health, to watch extra vigilantly for symptoms of COVID, and to get a test if they develop COVID, or excuse me, if they develop symptoms similar with COVID. Now, we recognize that the current exclusion rule would need to be updated to reflect this change in quarantine, and that will happen prior to March 12th. Next slide. And this is a schematic, and thankfully a little bit of a simpler schematic of now what to do, what you should do if you are positive or you're exposed to COVID. So as I mentioned, if you are positive for COVID, you should isolate immediately, regardless of your vaccine status. You may return to childcare after 5 days if you have not had a fever for 24 hours and if your symptoms are improving. And we strongly recommend that everyone 2 years and older continue to wear well-fitting masks for the completion of their isolation period through day 10. For children and staff who've been exposed to COVID, regardless of their vaccination status and regardless of wearing masks, quarantine will not be required. If children or staff develop symptoms, they should stay home and get a test. If they test positive, their isolation will need to begin either on the date of the start of their symptoms or on the date of their positive test. If they test negative for COVID, they may return to the childcare setting once they've been fever-free for 24 hours and their symptoms are improving. Next slide. The question often arises of when should we test for COVID? If you have symptoms of COVID-19, it is really important to get testing right away. And fortunately, tests are more available. So if ever your child or your staff develop symptoms of COVID, and the 11 cardinal symptoms of COVID are listed on the right, we recommend getting tested right away. In addition, for those individuals who've been exposed to COVID, while it's not required, some individuals may choose to get tested, and we recommend waiting 3 to 5 days after exposure to get tested because it takes a while for a virus to incubate in our body to get to a level high enough that it can be both detected by a test, but also high enough to be transmitted to someone else. So it's safest to wait a couple of days, 3 to 5 days after exposure to get tested. If you have had a very close exposure to COVID, you get tested after 3 or 5 days, you're negative, you still don't have symptoms. Our at-home tests are most sensitive if you do a series of 2 tests. So if your first test is negative, then you can consider, and again, this is optional, but you can consider to take a second test within 24 to 48 hours. And if you have 2 serial negative COVID tests, the chances that you're negative is quite likely. And I've included links on this site to resources for getting at-home tests. The government will now send everybody with an address for free tests, as well as all insurances, OHP as well as private insurances are now required to cover a number of tests to all members. And then additionally, there are still free testing sites around the state, and I included the link for those locations. And lastly, I just wanted to end on a note of the infection prevention considerations, which have been vital for the COVID pandemic and are exceedingly helpful for all infection prevention from the other illnesses that we know young children and the staff that love them and work with them can get. We recognize and encourage that every child care program consider the policies and practices that best support every child and staff's health and well-being, knowing that individual health conditions, as well as the social and structural determinants of health, place some people at higher risk for severe COVID. In addition, some childcare programs may choose to have all children masked, not only because it's easier for any individual child to do, to follow something as challenging as wearing a mask when their peers and their friends are doing it, but also because it doesn't single out individuals, and it may complement the culture and climate of a program to choose universal masking. Again, this is up to the discretion of programs. And the layered prevention strategies that have been so effective throughout this pandemic continue to be very effective, particularly with asymptomatic transmission. So vaccines and booster doses are still our best protection against particularly severe COVID. Staying home and getting tested if you have any symptoms at all, wearing masks when indicated, and continuing to cohort your groups of children as it's possible and feasible for your programs so that if there is an infection, it will have a lower likelihood of spreading to a large number of children. We're appreciating how important good ventilation is, particularly with these airborne viruses. So continuing to keep your classrooms well ventilated, opening windows when the weather gets nicer, and increasing the airflow is extremely helpful for reducing the risk of transmission. And then lastly, the basic fundamental practices of hand washing and covering one's mouth and nose when sneezing or coughing, and keeping up your cleaning routines continue to be important as Miriam said, we all learn to live with COVID. Next slide. So when will vaccines be available for the kids that we that are in most of our childcare programs, for the kids 6 months to 4 years old? Pfizer has submitted its application for review to the FDA, but the FDA decided to delay review because Pfizer, shortly after submitting, notified the FDA that they would have data from three doses of a vaccine sooner than anticipated. And what their data showed is two vaccine doses, the typical primary series that adults and older kids had, is insufficient for mounting a robust immune response from children 6 months to 4 years. Our immune system develops differently throughout our life, and so young children didn't develop a sufficient enough immune response after 2 doses of the vaccine. So the FDA will review the 3-dose series and then make a judgment on whether or not the Pfizer vaccine will be approved for young children. And we anticipate the FDA will review these new data in April of this year. So not soon enough, but coming up. And that, I believe, is the end of my slides. We have just included here some contact information. Again, the same resources that have been available throughout the pandemic, nothing new, but just a reminder that we are all still around and available for questions and to talk through scenarios. And thank you so much for your time.
Thank you, Meg. Do we want to take some questions now regarding COVID?
Thank you, Dr. Carey and Miriam. Yes, let's go ahead and cue Ronnie. I believe we have a few in the Q&A feature.
Sure. Okay. Thank you so much, Karina. Dr. Carey, could you please review the yellow and red zone information, and where can providers find out what zone they are in? And does it mean that they still need to wear a mask? They just want a review of this. This is new.
Absolutely, and this is brand new. Right now, the only place to find where your county is, what level of COVID transmission your county is in, is on the CDC website. I put a link up at the bottom there, but you can also type into your internet browser CDC COVID community transmission, and this link will pop up, as well as a map. And if you click on the map of Oregon, your particular county, the risk level in your county will show up. Now, the CDC calculates risk level by 2 different metrics. One is the level of COVID transmission in the community at large, how many people in the general population are contracting COVID, which has been data that the OHA has published and will continue to publish. The second metric that helps define what risk level of community transmission you're at is the number of people who are hospitalized for COVID and their severity. So how long they're staying in the hospital because of COVID. And again, this is really the shift, as Miriam was talking about, from our initial efforts to really contain COVID to our new goals to prevent individuals from developing severe enough COVID that they need to be hospitalized for it or tragically die from it. So we're really moving towards trying to prevent the most severe COVID and assuring that our hospitals do not become overwhelmed with the number of individuals who are getting COVID. So the community transmission levels, again, are based on general community level transmission and the impact of COVID on our hospital systems. I anticipate that the Oregon Health Authority will start to have our local community transmission level data published. Again, we share data with the CDC, so it's the same data, but I anticipate shortly in the coming couple of weeks, you'll also be able to get this information directly from the Oregon Health Authority's website.
Thank you. So does this mean that they'll never have to fully close their classrooms down again?
Miriam, do you want to take that one?
Well, because quarantine is not going to be required if staff are exposed, you're not going to have to shut down classrooms, most likely, unless all your staff contract COVID. So largely the reasons why classrooms were closing is because if there's one positive case in a kiddo, everyone in that group has to go home for 5 or 10 days if they were exposed. And so those individuals that are exposed to a positive case now do not have to quarantine.
Thank you. So should programs still be doing contact tracing?
No. So with the revocation of the indoor masking rule, so on March 12th, we're also asking that programs no longer need to do contact tracing. And contact tracing and quarantine are really linked, because contact tracing is what tells us then who needs to be quarantining. That said, we still encourage programs to notify staff, family members if there has been a positive, an individual who has tested positive for COVID, so we encourage families and staff to notify their program if they're positive, so they can still alert others in the program, as well as there's still a requirement to report positive tests to your local public health authority, so we can continue to keep track of community transmission levels. So there will be no more contact tracing, again, just in K-12 settings, childcare settings, and the general population. If you work in other settings, or you have friends and family who work in other settings, there will still be contact tracing and quarantine in those populations, like congregate residential settings and healthcare settings, where people are at highest risk for developing severe COVID, but no more contact tracing, no more quarantining for now in ELD childcare settings. And, and Ronnie, I realized I didn't actually answer your previous question about, so does this mean that when we're in the green, we don't need to wear masks? And this is what we're saying, is that when there is really low transmission in the community, partly because of the increased immunity, then the risk for contracting COVID is significantly lower. And depending on one's underlying health, one's vaccine status, one's general comfort, individuals and programs may choose to not wear masks anymore.
Thank you. And I think I have this one for Miriam. Miriam, are the programs still required to do the daily health checks, temperatures, documentation?
No, that requirement was lifted months ago when we moved from emergency childcare. That was shifted a little bit. So programs are not required to do daily health checks and temperature checks at all. What I would recommend is just do the normal licensing rules do require that kids get excluded for a certain number of symptoms, and that has not changed. So it's still a good practice to keep your eye out for sick kiddos when they come into care, and to call the families and send them home if they're ill.
Thank you, Miriam. And I think this will be our last question. How about a staff member that's on a medical or religious exemption? Do they need to continue to wear a mask at work? And I believe that is if they're unvaccinated.
So beginning March 12th, regardless of vaccine status, there is no requirement for individuals to wear masks indoors.
Thank you. Okay, Karina, we can move on.
Thank you so much, Ronnie, for checking those questions. We see that there are other questions that we haven't had a chance to answer at this point. Some of these we will be able to follow up via email if we have your name and email address here. So if your name is showing up, we will get back to you. With that, I'll go ahead and transition to Alyssa Chatterjee, our Early Learning Systems Director. Thank you again for joining us this evening. And you'll go ahead and introduce the next topic and our next panelist. Thank you.
Thanks, Karina. Good evening, everyone. My name is Alyssa Chatterjee. I'm the Early Learning System Director. And we had heard from you all that you are interested in learning a little bit more about rulemaking. So we wanted to just share a little bit about what the Early Learning Division's process is when we adopt Oregon administrative rules, as well as opportunities to participate in the rulemaking process, and a preview of some rules that are actually going to be coming up. So I am going to turn it over to our rules coordinator, Remy Watts.
Hi, everyone. Thanks, Lisa. I am Remy Watts. I am the division's rule coordinator. You may also recognize me as the Early Learning Council administrator. Here in government, we have a lot of combined duties. And I am so excited that y'all are interested in learning about rulemaking. It's a pretty boring process, but I'm going to make it as fun as possible. So if you'll move on to the next slide, please. We're just going to take a step back really fast and just talk about like what even is a rule, because if we're going to be totally honest, I didn't know what a rule was until a few years ago, really. So rules, like if you think about like everyone remembers the Schoolhouse Rock, like I'm just a bill, right? And the bill, it goes up onto Capitol Hill and then it gets signed. And then that's where law stops, right? No, it's wrong. The law actually modifies statute, which then gives us government agencies the leeway to write more specific rules that are within that statute. So I hope that makes sense. Rule is just basically a very like a bullet point to what the law is. So we have a couple of different reasons that we engage in rulemaking. Number one is going to be when the governor signs a bill into law in the state of Oregon. So, you know, the 2022 legislative session is about to finish and we're going to have to do some rulemaking around the bills. Another reason that, sorry, let me back up just a second really fast and just do a couple of Easter eggs. Allowing the agencies to write more specific rules. I put all of those little clip art people down there because it's representing you helping us write the rules. Okay, let's move on to the second reason that the Early Learning Division engages in rulemaking, and that's when the feds tell us we have to. So a lot of the funding that we get for programs within the Early Learning Division is going to be funding from the federal government. So pay attention right now. A really great example of federal funding that has rules around it is the Child Care and Development Fund, CCDF. I'm not sure if you've ever heard of it, but it funds like a huge portion of our operating budget, like 75%. And we get over $275 million to fund preschool and childcare programs. So one of the reasons that we would make new rules is because sometimes those federal rules change and we have to amend our policies to match with that. So I think the next thing that we're going to talk about, if we go on to the next slide, the rulemaking engagement process. So when we have these reasons where we have to modify rules, we go through a certain process at the Early Learning Division that I wanted to go over with y'all. So there are several steps until the final step is going to be the vote by the Early Learning Council, which is our governing board. And there are several different ways that we can get input in order to build that final rule set. So the first way is, I don't want to say it's informal, it's legally not a requirement, which is when we do interested party engagement. So that's like a work group or an engagement session, kind of like what we're doing right now, this webinar. Anything that we get the opinions and feedback from members of the public who are going to be impacted by our rulemaking. A more legal way that we have to take in order to create rulemaking whenever there's a fiscal or an equity impact is a rulemaking advisory committee, and that's required by the Oregon Secretary of State. Whenever there's a fiscal or equity impact on any rulemaking. So other state agencies also do rulemaking or rulemaking advisory committees, RACs. So we have a few RACs going on right now that I'll talk about in just a second. And then the last two steps before we go to the final vote by the Early Learning Council is we have an internal review from our lawyers. We have a review from our internal policy team, which has like a bunch of people on it. And then we also have an evaluation by the Internal Equity Advisory Committee, who helps us create language that has a better, that lifts everyone up better. And finally, there's the public comment period. So the public comment period usually happens in the 3 weeks before the Early Learning Council meeting. So we post our rule language on the Early Learning Division blog by the 1st of the month. So for instance, March 1st, there are like, I think 5 rule sets on the blog that are up for public comment right now. So you can see there's a link. And if you go to the Oregon Early Learning Division website, it's like the News and Resources tab. Oh, awesome. Allison dropped it in the chat. So those are the 5 different steps that it takes before we get to the ultimate vote by the Early Learning Council. So I wonder if there are any questions about this process. I'm sorry that it's kind of technical, and I'm hoping that I explained it well. I don't think that there are any questions on the rulemaking engagement process or RACs, unless I'm missing something. So that's awesome. Maybe I explained it well enough. If I didn't, my email is on this PowerPoint slide. It's in one of the slide decks. Oh, what if we providers do not agree with the final rules? Well, that's where the public comment period comes in. So when you see the rule set that's posted at the 1st of the month, you email me and you tell me why you don't like the rules. So, and then I read every single piece of public testimony. I promise, I've read them all. And we take every single public comment into evaluation. Normally we do not know until the rules are done. Subscribe to our public notifications, and then you'll start to get notifications. If you go onto the homepage of the website, just the Oregon Early Learning, there's a place where you can subscribe to public notifications. It's just like on the left. And if you put your email in there, then you'll get the emails when these things are up. And is there anything we can do? Yes, there is public comment. The first, like I said, the 1st of the month is going to be an open opportunity for whenever we have rules at the end of the month. So it's a 3-week period. And then technically you can also submit public comment to the Early Learning Council. So it's actually really a month. But yeah, I hope that clarifies. Let's see. Okay, cool. I think those are all of the questions, but once again, if you have any more, my email is going to be on the slides. It's remy.watts@ode.oregon.gov. Very straightforward. So now what we're going to do is move on to what type of qualifications does one need to have to be on the RAC? Oh, that's a good question, Dawn. Just really quickly, the RAC, we look for different different partners in the RAC building process. So it really depends. You have to read the application. I assume that most of the rules that you're going to be interested in are childcare, are going to be rules that affect childcare providers. Come on. Sorry. So it just kind of, it depends on which RAC we're looking for, but any rule making advisory committee that has rules that are going to affect childcare providers, just being a childcare provider is qualification. So really a pretty low bar, I think. You just have to be a childcare provider. So everyone here can apply to be on a RAC, that's if, we're usually, I think every single rulemaking advisory committee we have going on, we have childcare providers on, and we usually don't not have a childcare provider on our RAC. So everyone, why would someone get denied for a RAC if they don't fit our what we're looking for is to build a RAC that reflects the diversity of Oregon. So we're looking for geographic, linguistic, racial, ethnic, and socioeconomic diversity. So we're looking more at that framework and seeing which applicants fit within the framework. That way we can have a broad group of voices at the table. Okay, I am going to move on because I feel like I have to. So thank you for all of your questions. If you have more, once again, remy.watts@ode.oregon.gov. It's on one of these slides. We'll go to the proposed rule overview. So do y'all remember when I mentioned the Child Care and Development Fund, CCDF, and I told you to remember it? Yes. Excellent. We're at that portion of the evening where we are talking CCDF, which is one of my favorite topics to talk about, to see people's eyes glaze over. So basically we have the CCDF telling us that our policies don't align in a couple of different ways, and we have to bend to fit the CCDF policies in order to continue getting our money. So that's going to be the allergic reaction rule and the child development training rule that we're about to talk about. And then finally, I'll mention we're having the fire safety rules. I'm sure you heard of them. We've got them temporary right now for certified family and registered family. And I'm going to give you some more information on where we are in that process. So if we'll move to the next slide, please. Thank you. This is a lot of text. This is basically just saying, like, CCDF is telling us that we have to update our requirements around allergy care plans. So it's a pretty short little blurb just requiring different pieces of an allergic reaction plan in the childcare facility. So the public comment period is currently open and it's going to close on the 23rd. And then we have a public hearing scheduled. Click on the news resources blog, like I said, to find more information on that. There's also within that blog post there are links to the calendar events with all the other documents. There's a bunch of stuff in those links. So go click around and you'll find all the proposed rule language. You'll find how to submit public comment to me. And let's see. Oh, and then of course, OCC will update any relevant forms to assist with compliance. We will be giving TA on this. Let's see, why don't we go to the next slide now, which is same thing. CCDF is requiring us to change our child development training. Sorry, I have some very excited dogs in my house. I, like you, am a person with dogs. Anyway, we've got the child development training that we have to update the policies on. So it's generally just kind of a cleaning up of the way that the rules are laid out, as well as having everything, excuse me, align with CCDF policies. So there's going to be if you'll see right there, all staff will be required to take this training. It's going to be online starting in July. We're working with a consultant to offer free trainings. You're going to have new staff will have 90 days after they're hired from now on to complete the training. And then if you're an existing staff member, you've got to complete the training by September 30th. I heard that it's going to be a 2-hour training. I think that's right. But if I'm wrong, please don't yell at me. Let's see, there will be a public comment period, all that good stuff. All the stuff that I said before is right there. So why don't we move on to the next one really quickly, and then I will answer some questions that I'm seeing. Okay, so this is fun. This is, if you haven't heard of it, now you have the Certified Family and Registered Family Fire Safety Rules. So we have some temporary fire safety rules that we promulgated in the January Early Learning Council meeting that are basically workarounds to having a full sprinkler system in your certified family or registered family care home. These are temporary rules that are in place right now, and you have an opportunity to weigh in on the final language. So we are currently recruiting for the Rulemaking Advisory Committee. So this is a RAC that you can apply to as a child care provider. They're available now, and we're going to be accepting applications until March 11th. So if you want to have your voice heard in the fire safety rule rack, make sure to apply. However, if you don't make it onto the rack, please don't take it personally. It's totally not a personal thing. We just get a lot of applications sometimes, and we only need, like, we can only really have 10 to 15 people on a rack before it gets totally chaotic. So if you don't make it onto the rack, don't fret. There's more opportunity. I read every single piece of public comment. I'm not kidding. I've read all, if you've sent me public comment, I've read it and I've regurgitated it. So the public comment period we are anticipating will be open May 1st to 20th. And there will be a public hearing that we're scheduling to be decided. Make sure to subscribe to the public notifications so that you know when that happens. And then there will be a vote on May 25th. So that's when those rules will go into effect. Let's see. Oh, I'm sorry, Deborah. I'm sorry. Okay, rule language, public comment. If we want to move on to the next slide. So I've been talking about this link a lot. I've been talking about my email a lot. Here they are. Find the draft rules on our blog. There are, well, the blog has a summary of everything that we have open right now, along with calendar links that contain the full rule text, all of the different meeting materials, good stuff like that. And there are instructions on how to submit public comment, which is pretty easy. It says Word or PDF, but you can just send me an email if you feel like it. And there's my email, remember.watts@ode.oregon.gov. Also Remy, REMY.watts. I have 4 emails. I did not ask for this life. Okay, and don't forget to check the Facebook as well. Facebook is always going to have this kind of stuff. So let me answer a couple of quick questions that I see over here. Those are some COVID questions that I am not able to answer. I'm so sorry. If it is not a rule yet, do we need to be in compliance? So right now, I'm assuming that you're talking about the fire safety rules, anonymous attendee. Okay, awesome. Yeah, so technically we do have temporary rules in place around the register or around fire safety for certified family and registered family care homes. So yes, you do need to be in compliance. Technically, I feel like Alyssa, you might be able to speak more about like there are some details around being in compliance with like local zoning people that I am not as talented as talking about as you are.
Thanks, Remy. Yes, so the temporary fire safety rules are currently in effect, but we don't expect folks to be able to get into compliance overnight. So right now, your licensing specialist will provide coaching and assistance, and we'll be monitoring this during your licensing visits. And we will have to respond if there's a complaint. But generally speaking, we know it takes a little bit of time to get into compliance here. And then as Remy has shared, we will be adopting permanent rules and we'll have the same kind of opportunity to help give providers access to resources and coaching. Most of the fire safety rules, which as Remy mentioned, you can find on our website, have to do with posting requirements in terms of where the usable exits are in the home. It talks about having carbon monoxide detectors up, making sure that you're testing your smoke detectors every day, making sure you have your fire extinguishers accessible. So the nice thing about these rules and why we were really excited about them as an alternative to a sprinkler requirement that the Department of Consumer and Business Services has is that it's pretty low cost. The other piece that it does require is evacuation drills. So again, you can find all that information on our website or reach out to your licensing specialist if you have any questions.
And can I just chime in, Alyssa, really fast? You just reminded me, one of the ways that public comment has really, like I said, public comment, come at us, guys. When we had the temporary rules, there was a requirement to have a drill during nap time. and we heard you and we took that out. So that's not in the temporary rules. And just for clarification, where these rules are offering an alternative to a sprinkler system that's required by another agency's rulemaking. So like Alyssa said, they're all low cost alternatives to installing a sprinkler system in your home. So I think they're pretty doable. I would do them. I have done them in my own home. So I'm hoping that it'll be something that everyone will be able to handle. But like I said, you get your voice in the final design of these rules. So if you want to get your voice heard, apply to the RAC, send me public comment. Okay, excellent. Okay. I think there are a couple. This isn't for registered family for sprinkler, right? I'm having a little bit of difficulty understanding your question, Debbie. And then Crystal, this registered family care homes, there are fire safety rules that, like I said, circumvent you having to install a sprinkler system. So there are just going to be, if you click, there are draft rules up on the blog. Look, we just went back to that. And if you go click on the blog, you can see specifically what the draft rules are. And the draft rules are the temporary rules, the current requirements that are going on. I hope that makes sense. Okay. All right. So a couple of these, the fire extinguishers, these are all questions that unfortunately I'm not qualified to answer. I think, Deborah, I think that would be a great question for your liaison. Okay, excellent. And unless there are, thank you. Unless there are any more questions that I'm seeing,
Remy, I'll just jump in and clarify too, again, that the early learning division does not require sprinklers in childcare, and this fire safety rule does not require sprinklers in childcare. We wanted to make sure you were aware of this temporary rule that passed in January, so you have an opportunity to weigh in on the permanent rule and the rulemaking advisory committee applications that are currently open. The temporary rule that Remy has mentioned is available on our website, requires having a fire extinguisher easily accessible, adding carbon monoxide detectors, again, the evacuation drills. It does not require sprinklers. This was an alternative that we were able to adopt because the Department of Consumer and Business Services had passed a rule last year requiring new registered and certified family providers to have a sprinkler system installed. So these rules that we have passed, even temporarily, do not require you to have a sprinkler as long as you do these other things that you can read about on our website.
Right. Yeah, thanks, Alyssa. Yeah, we really want to emphasize you don't need a sprinkler system. Anyway, okay, awesome. So I think that's going to be the last question that I take on the rulemaking and the rule language. Once again, if you have any additional questions on the early learning division process, government can be a black box. I try to make it transparent as I can for you. So please don't hesitate to reach out with any questions. And now I believe I will turn it back over to, let's see, Karina or Ronnie or.
Thank you so much, Remy, for walking us through this. I just got to say, we appreciate the energy and enthusiasm you shared. You did say this was very technical, but there was great response from providers, and hopefully this was really helpful for people to understand a little bit more of what this process looks like and how to get involved. That's the other reason we really wanted to share. Want to make sure that this process is accessible to everyone and that you know that we want you to be engaged and to participate. So thanks so much, Remy, for joining us and sharing all of this great information. We have a few more minutes. We acknowledge we had scheduled this meeting until 7:30. That was before we had a lot of these COVID updates. And as you all know, it's been a very busy week in terms of COVID updates. And because of that, we do want to go ahead and take 5 or or less minutes to answer a few of the pending COVID questions or some of these that we think might be important to address. With that, I'll go ahead and pass it over to Ronnie, if you can. And we have Miriam with us. We have Dr. Carey had to take off for the evening, but we have Miriam with us, and we'll go ahead and take a few more of these. Thank you.
Thank you so much, Karina. So Miriam, this question is for you. If the provider is the only caregiver in the home and somebody, a relative or somebody that lives in the home has COVID, do they have to quarantine or stop doing childcare for 5 days, or what happens?
So if you're exposed to COVID, you no longer need to quarantine. That requirement is changing, and that announcement is going to go out tomorrow or later this week. But the requirement to quarantine if you're exposed is it's no longer required. If you contract COVID, then you'll have to isolate.
Okay. Thank you, Miriam. So there was a question about, is any of this going to change now that we know that the children, that the vaccines weren't working as they had hoped in the test?
I don't feel like I can answer that question, Ronnie. What I do know is changing is how Oregon Health Authority is preparing for us to move forward with how COVID is, what the declining case rates and declining hospitalization rates and increase in our community's immunity. So any kind of response to inefficacies of the vaccine, I am not aware of direction around that.
Thank you, Miriam. Yes, it's hard to look at all. So can you also confirm that tracing charts are no longer, contact tracing charts are no longer necessary?
That's right. That's going to be a record keeping requirement that will be lifted once we make these changes to the ELD requirements and recommendations guidance document. So you'll see that removed.
Okay, fun stuff coming. Are cohort sizes still limited?
No, that requirement did change a few months ago. So your regular group sizes, if you have group size requirements for your licensing type, those will remain.
Okay, and just to recap again, what are the masking requirements for the yellow and red counties?
So after March 11th, no one will be required to mask. The recommendation in medium or high risk is that you do mask, but it's not required.
Okay, thank you. So it seems like there's just a lot of questions around the quarantining. It's just a new message, and I think some folks are just really unsure and wanting us to keep repeating about the quarantine process.
Yeah, it's big news.
Yes, it is. And very.
I think a lot of people may have a hard time understanding the difference between quarantine and isolation because we're used to excluding from care for either one. But quarantine is when you're exposed. Isolation is when you're sick. So quarantine is no longer required. Isolation is still required. So if you get COVID or if you have symptoms of COVID, then you do need to stay home. If you are exposed to someone who has COVID, regardless of if you're vaccinated or not, you do not have to be excluded from care anymore.
Thank you, Miriam. That was really clear. If a child has COVID symptoms, do they still need to be quarantined?
No, they don't need to be quarantined, but what we do recommend is that they stay home, get tested, and come back when their symptoms are improving. If they get a negative test, come back when symptoms are improving. If they test positive, stay home for 5 days and then come back when symptoms are improving.
Okay, thank you. So Karina, it's 6:59, and I think that gives you 1 minute to close out.
Thank you so much, Ronnie, and thank you so much, Miriam, again, for taking some of these COVID questions. I do want to acknowledge that we have one question regarding childcare stabilization grants, and we do not have Don with us today, but the question just reads, are there any grants on the horizon after the childcare stabilization grants? Should we assume that all COVID grants are done? And I'll go ahead and pass this one to Alyssa just to get a little update of where we are in terms of grants.
Thank you. Great question. So right now there are no new. Oh, yes.
I'm so sorry. I just wanted to let you know that the ASL interpreter was scheduled until 7 and unfortunately can't stay after. So I will be leaving, but I just wanted to let you know.
Thank you, Rebecca. We'll be quick. So we don't have any new childcare stabilization grant or other COVID grant applications open right now. We are continuing to deliver childcare stabilization funds through the grant process through those who already have a grant agreement with us. I wouldn't say we shouldn't expect more. There could be additional federal funding that comes. There is also some funding that's being considered by the legislature right now that would see some payments to providers. That would be a different process. So we'll have more to share on that in April. But as of right now, there are no new grant applications for COVID related funds.
Thank you so much, Alyssa. And with that, we would love to once again appreciate everyone for joining us this evening. We have dropped in the Zoom chat, and we'll go ahead and do it in the Facebook chat as well. Childcare updates, we've heard these repeated several times today, and this is one of the best ways for you to get access to timely information. At the end of the webinar, you will also receive a survey link. We would really appreciate if you took 2 minutes to fill that out. It is really helpful for us to improve these monthly webinars and to take in some of your feedback. And lastly, the slides and the recording will be available on our website. You go into the COVID section, there's provider section, and if you scroll down midway, you will find the information for this recording and this slide deck, as well as previous information sessions. And you will also be able to find the recording on our Facebook page. So with that, thank you again for your time. Thank you for all of the work that you do with the children all across Oregon. And we look forward to receiving any of your questions. We've dropped some of those contacts in the chat, I believe, and again, they're in the slide decks. And with that, we'll go ahead and see you next month. Thank you so much.